Hi, Sophie. Thank you
Hi.
very much for agreeing to tell us about your experience of taking a student recently. I wondered if you would mind just explaining where you work and what your job role is to start with.
Yeah, so I'm an occupational therapist based at Rampton Hospital, which is a high secure hospital. So I work within the men's personality disorder service, and my role is to work. I have a caseload of 26 patients and work across two wards. One pre-discharge ward and one treatment ward, which is very different. And we basically try and encourage patients to engage in their meaningful activities, to try and mitigate some of the barriers that they've experienced throughout their life, to try and progress them through the treatment pathway. So it's all about progressing in and learning new skills, whether it be activities of daily living, transitional work, so preparing them to move forward in the pathway to medium secure units, and improving their skills on a day-to-day basis.
And what kind of placement did you offer? Because it didn't go quite to plan, did it? It was a sort of started off and then had to be restarted because of the pandemic, didn't it?
Yeah, so my student, she started in March in the women's service, and then I think she did about 2 weeks, and then basically it just came to a stop. Literally, you need to leave now. So that was in March, and then she came, and I was her educator from the start to the finish, from the beginning of November. So yeah, it was quite different for her because she came from the women's service and then she came to the men's personality disorder, which was it's quite nerve-wracking for her. So yeah, it was.
Your service was a bit restricted, wasn't it? You were working in a different way yourselves at that time. You told me, weren't you?
Yeah. So normally we would try and get patients, they would go through an assessment process, and then they would be able to go to different areas eventually. So we have our own areas down in the PD service, and then they'd go and work their way over to the main hospital. So we've got a range of different areas: horticulture, graphics, we have woodwork. However, the pandemic, I think it was the 3rd of April, we just shut every department down and patients weren't allowed to leave the ward, and weren't allowed to access any tools. So TED, which is Therapy and Education Department staff, they got deployed to the wards to facilitate the activities on the ward, which is very different. It's a very challenging way of working.
So what sort of barriers did you have to overcome then to give that student a good placement, and what did she feel about it?
So the first thing I would say to anybody, she appreciated it so much. It's a really difficult time, and she was obviously having conversations with her friends at uni who were doing a lot of case studies, a lot of working from home, and actually, and I can speak from personal experience how much I valued my placements, and she just excelled coming here, and she was so grateful to how I adapted her placement so she could meet her learning objectives. And it's unprecedented times at the moment, and we don't know how long this is going to go on for. It's such a valuable experience for students to be in their clinical roles, because although the likelihood of something like this happening again on such a large scale is probably minimal, we don't know. And for them to experience working in a different way of working is just, it's so valuable for him. Really, really valuable. And I've had to adapt, and she had to adapt. And actually, that's such a good skill for an OT to have. And it's improved my confidence definitely, because I was nervous. I was really anxious. She was my first student, and I thought, what am I going to do? How am I going to work this? But she was patient, and yeah, she really appreciated it.
Was there anything else you had to do sort of differently? I mean, did you find that you could just make the changes in the placement, so that she could sort of meet her learning objectives then? Did that all work out?
Yeah, I mean, the patient group we work with are very, they're challenging, and their motivation to engage can fluctuate, which that happens anyway, regardless of COVID. But one of the main differences was the fact that at the start of the pandemic, the hospital decided against no tool use, which is such a big area in our off ward areas, and it was in terms of managing that risk, assessing that risk, and she wasn't able to fully see how we would work with patients and those tools. So I thought of ways around that, and rather than just explaining it, I would incorporate it into our prep time. So I would just say, right, we're gonna work like this, as though we've got patients, as though if we're using those scissors, we do the process and the policy of how we would do that if we were working with patients. So there was always a way around of, it, although she didn't experience it in sessions with patients, she managed to look at how we assess risk and how we manage that risk.
It sounds like a really great place. It sounds as though she really appreciated it and got to grips with it, even though it was perhaps a bit different.
Definitely, yeah. She like I say, I keep saying it, but she excelled, and she understood so, how difficult it was, and just appreciated the time that she spent here.
That's brilliant. Thanks ever so much, Sophie. That's really interesting. Thank you for talking to me.
You're welcome.